Hello, and welcome to the weekly dementia blog sponsored by Spectrum Med. My name is Dr. David Hutchings. Again, we're going to continue our series on what to do after the diagnosis of dementia and Alzheimer's. We had a great turnout with the NARA conference last week, the National NARA conference, and the week before with the Tennessee Alzheimer's Association conference, and yesterday with the Unity Behavioral Health Conference here in Middle Tennessee. And then also, I'll be excited about tomorrow. We're doing a presentation for caregivers for Morning Point. So looking forward to doing that as well. So let's go ahead and get started. We've covered a multitude of topics of what to do after diagnosis in terms of depression, in terms of memory issues, behaviors, sundowning, medications, all these. And so I want to kind of go through these series a little bit more and talk about the L's of caregiving. And this actually comes from a wonderful text from Dr. Daniel Potts. He is one of the nation's leading specialists in dementia and Alzheimer's disease, and he's got a wonderful book about caregiving for those who are caregiving for patients who have dementia. And he calls these the L's of caregiving. Number one, live in their world. That's something that we used to try to reorient patients in the past, and that's definitely not what we want to do. I know maybe a lot of you know that, but some of us still don't. So reorienting the patient to date, time, year can create behaviors and a lot of agitation. And love them for who they are. I know we try to think about who they used to be, but we are dealing with a disease and we're dealing with kind of a new person now. So we need to love them for who they are and learn to value some of their remaining talents. Many of my patients have incredibly amazing talents that they used to possess and still are able to do a lot of things. I've got patients that play the piano. I've got patients that are able to sew and do different things, woodworking, things like that. So try to value some of their remaining talents and gifts. Let them remain and maintain structure independence, and also listen to them and listen, and laugh with them. I know it's very hard as you become a part of their world to do this. But also that can help decrease some of the behaviors and also decrease some of the burden that you have as a caregiver. Also line up some respite opportunities. And I've talked about this before, making sure that we have caregivers that can come in the home that kind of gives you a little bit of a break. I've got one patient in mind right now that he's a wonderful father and wonderful husband, and he basically takes time every day to take his wife for a drive at the same exact single time every day, and has caregivers that come in every single week at the same exact times. And we've talked about how important that routine is. And lastly, looking past the disease and trying to see who the person is now. I know that's incredibly difficult to do because this is someone that you've known for your whole life, and also maybe been married to your whole life, but also looking at them and knowing that this is a disease that we're dealing with, and knowing that this is kind of the new person that we have to be with, and understand that this is caregiving is extremely difficult in a sense of you don't get a lot of thank yous and like you would caring for somebody that does not have Alzheimer's disease. It is by far one of the hardest journeys anybody will ever have to endure. So making sure that we remember who they are for sure, understand that they are different now because of a disease, love them for who they are, live in their world, listen with them, and also laugh with them. And hopefully that will help ease some of the burden that you have as a caregiver. Next week, we're going to talk a little bit about some more things. Again, what to do after diagnosis. We're going to continue this series the next few weeks because we get a lot of questions about this. And also with a lot of lectures that we do, there's a ton of questions on support for the actual caregivers. So we're going to continue this series for the next few weeks, and I look forward to seeing you again next week. Thank you.